everyone. Thank you for joining me today. My name is Rosalind Young Daniels, and I'm president and founder of Black Health Matters. I've prepared some opening remarks that I'll reference as we discuss survivorship today. At Black Health Matters, our mission is to elevate conversations around chronic disease that impact the Black community. And cancer is one of those conversations that we want to build more awareness around. As a cancer champion and one who's experienced cancer herself, it's a pleasure to be here. Many people in my family, especially my beloved grandparents, died too soon. When I think of my grandmother, I loved her so dearly, but she did not talk about her illness. She did not talk about her pain. She did not share that with her immediate family. She did not share it with her friends. And seeing a doctor was the last result. My grandmother was admitted to a hospital and died roughly about 4 days later. But that story is just not special to me. Many people in the Black community have the same types of experiences. Our frame of reference is impacted by social barriers, known as the social determinants of health. But we know that we can do more, we can do better, because knowledge is power. And what did Maya Angelou say? When you know better, you do better. We are delighted to have a wonderful panel of Black powerful women. So let's start. Tamron, tell us a bit about yourself.
Hi, everyone. I am Tamron Woodle, a 15-year peritoneal mesothelioma survivor. And that's what pretty much led me to write about my experiences coming from a transparent moment. And, speaking on those things that some cancer patients and survivors may be a little hesitant to talk about or to ask. I'm also a mom of 4, and just raising my children, I am instilling within them about the importance it is of knowing your body and knowing how to navigate the healthcare system. When I was pregnant at month 4, when you go find out the sex of your baby, I found out I was having a baby boy, and I also found out I had a fibroid tumor. So I say that I was misdiagnosed because it wasn't a fibroid tumor. And so the symptoms that I was having, I later found out that it was, in fact, mesothelioma. And I never met anyone as a woman of color with mesothelioma. So I was very curious to find out more about it. And so that what pretty much leads me here today.
Awesome. Thank you, Tamron. Crystal, please introduce yourself and tell us about your journey.
Hello, everyone. My name is Crystal Champion, and I'm a breast cancer survivor in the Atlanta, Georgia area. And I was diagnosed with early stage breast cancer December 31st, 2019. And I was very fortunate to catch my breast cancer at an early stage. And being that I'm also a physical therapist specializing in cancer rehabilitation and lymphedema treatment, I always say that my profession saved my life. It forced me to be more proactive regarding my screenings to be able to catch my breast cancer. And even with the medical experience, that does not mean that I did not have my own struggles with cancer survivorship. Being a single Black female, I actually had to go through my breast cancer journey alone outside of support from my immediate family. So that was very difficult for me because I'm a very independent person and I pride myself on doing this thing called adulting successfully and on my own. So really having to be humbled down to rely on the support of my family as a single woman was very hard for me and was something that I really struggled with from a mental health standpoint during my journey.
Crystal, that's very interesting because I'm an ovarian cancer survivor. And literally, my physician spent 1 hour on the phone with me to explain why I needed to tell my family. I actually attempted to go through all of it alone, the surgery, the chemo, all of it, without telling a soul. And she literally had to spend time convincing me that that was just not the way to go and that it would not serve the purpose for my family, my son. And she was absolutely right. But that just goes to show when you think that you're so used to doing that you just think that you can persevere and just walk through and break through. So, Eukarya, please talk to us about who you are and the type of work that you do.
Thank you so much. It's great to be here with all of you. My name is Eukarya Borden, Vice President for Health Equity at the Cancer Support Community. I've been at the Cancer Support Community now for just a little over 2.5 years. I'm an oncology social worker, a licensed clinical social worker in the Philadelphia area. Working alongside our patients helped me to see our health system in a different way through their eyes as they questioned, as they challenged, as they worried about whether they were getting the best care. And so I come to you today as someone who has been that provider and as someone who is the daughter of a cancer survivor, the granddaughter of someone who died from cancer, and many other family experiences as well.
Today, again, we're going to dive a little bit deeper, and I thank you for those wonderful introductions. Tamron, in my time at Black Health Matters and in my own life, I've seen that there's so many barriers that Black women face to care, and especially when it comes to cancer. What can you share about how representation is important?
That's a very great question, Rosalind. Representation really, really matters, especially in the cancer community. When I was first diagnosed with peritoneal mesothelioma 15 years ago, I knew nothing about it. I didn't know what it was, barely knew how to pronounce it. But, I was just like, okay, what is this? And the information that we found, it was pretty much saying that the typical patient was a white male that usually worked in the coal mines or some type of factory, age 67 to 73. I was 21 years old, so I'm like, that does not fit me. I'm not the typical mesothelioma patient. So it was hard for me to navigate through those areas at first because I couldn't find anyone who looks like myself that I could say, hey, what should I expect? And,
But let me just ask you this, and I'm sorry to interrupt, but I mean, you have a very rare type of cancer, a cancer that's really not experienced by Black women.
Right.
So what coping mechanisms? How did you keep yourself going? Because who do you speak to? Who was your community?
Right. And actually, I didn't find a community until a decade later after I was diagnosed and I had treatment. But I kind of went through, and I actually wrote an article about this. I kind of went through a certain stage when I was diagnosed. So first I was shocked. I really didn't want to talk about it. And then I was in the headspace of why me? Like, Lord, what did I do so bad that you gave me this and they're telling me I have 18 months to live?
I'm sorry. And that's exactly what they told you? 18 months.
18
Oh my goodness. Okay.
Yes.
Get your affairs in order. That conversation.
Yes. Right. Yeah. They actually called in a grief counselor the day that I was told. So so that is pretty much when my faith kicked in drive. And because that's all I had to lean on. I didn't have a solid foundation with the information that was out there. All of the patients that I saw that had it, they had died and they were old, and I'm here, this young woman who just had a baby, and I'm like, what is going on? So I coped with it. My church family held me up in prayer, and, I got through it the best way that I knew how.
Thank you for that. Crystal, Was your experience similar? It sounds like yours was slightly different because you didn't want to share. Is that correct?
That is correct. Well, I never thought in a million years that I would be diagnosed with breast cancer. And it was very difficult for me. I really didn't want to share it with anyone outside of my immediate family that I had been diagnosed because it took a lot of thought for me to have to figure out what I needed for myself for my own personal journey. Again, just having to rely on immediate family and support was very difficult for me to do.
Was there a tipping point where you understood that I have to make this connection and really be more open with my family?
Absolutely. I think just the stress of it all and having to process everything. And I had to think about it. I had to have an ego check and say, Crystal, I know you're strong, but strong doesn't necessarily mean that it's a good thing to be in every single situation. The strong also need support. And so I had to realize that quickly before I went into this dark place. So I had to have, and I needed the support of my family. I do come from a strong knit Christian family. So having their support and their love and their prayers really helped me to get through what I would call one of the most difficult things I've ever had to deal with in my life.
No, I understand that. I mean, throughout my journey, I actually said that I felt highly favored because I felt that I did have strength flowing through from somewhere. Let me ask you, what about support in terms of outside of your family? Were you able to find that?
It took a while once I felt comfortable enough to seek support outside of my family. I actually have family members that had breast cancer, and I also had a few close friends who were also breast cancer survivors, but I still kind of kept my diagnosis initially in a small circle. And I was one of those, I feel like, let me just get through it. And then once I'm through it, then I can share with everyone what I went through, and then I'm now on the other side. But at the time, my headspace was, let me just get through it. Let me just, have my small circle, my small support team, and then I'll be okay.
That really resonated with me. And I think it's really knitted into the culture because decades ago, if you had cancer, just as Rosalind said, you wouldn't have told anybody. It was something that was like, oh, it's the C word. You don't, talk about that. Let's not, even though it's the huge elephant in the room, no one really talked about it. So I think that is unknowingly passed down. And a lot of people don't want anyone to know. It can be out of embarrassment, or you don't want anyone to look at you differently because you have cancer, because of the stigma that has been placed on how you should look as a cancer patient, how you should feel, what you should go through. So I definitely resonated with that, what you said, Crystal.
And Tamron, I definitely agree with you on that as well, because in my household, it was like what goes on in this house stays in this house. Mm-hmm. However, that is so damaging to us in the Black community, because talking about our family histories of cancer and what does that look like, we're just in a world of not knowing and not being educated enough. Like, for example, I had a great aunt Lucinda who died when I was 6 years old, and I was always told, well, she died from bone cancer. And so now that I'm older and I can understand that, I'm like, okay, well, what type of bone cancer was that? And what is it that is in my family line, in my medical history, that I don't know about? So it's so important for us to talk about our medical history and just to inform each other, because it's crucial to how we proceed and how we seek out medical care and how we go forward with screenings for ourselves.
Right. So, Eukarya, I know you want to jump in.
Please. I sure do.
I know you want to jump in. Tell us about the quest for understanding and managing through.
I cannot tell you how many times I've sat with a patient who's, whether they're newly diagnosed or whether they've been, in treatment for a while, who had said nothing to their families. Yet they would be in my office talking to me about what they need, what they didn't have. And I would suggest, you've got children. I don't want to be a burden to them. And it is such a detriment because, we have these support systems and people in our lives that love us and want to be there for us, but we have to actually make the choice to allow them to support us. And listen, I've worked with many patients who don't have care partners, caregivers, loved ones, families. And so they are doing this alone by default. And I think this is such an important conversation that I was listening to between you, Tamron, and because it's something, Tamron and Crystal, because it's heartbreaking to know what's happening to other Black people, right? It's as a provider, as a daughter, as a friend, and there's so much that we can do, but we have to opt in, essentially. That's what we have to do. We all have to opt in, whether we are, no matter what our profession is or anything. Like, this is personal. This is personal for all of us in one way or another.
Well said. Let me ask everyone, in terms of your experience, did you feel that your clinical team was diverse? Do you wish that they were? Did that have any impact on the way that you communicated? Or did you have, and if you had trust in your care team?
I guess I'll go first. My initial care team was not diverse. To be honest, you guys, I really didn't see color. I really didn't think to myself, well, if he's not Black, I don't want him operating on me. No, it doesn't matter. If he says that he's a specialist and I read about him and he has did his research and he's look at me, straining my eyes and tells me, Tamron, you're going to be okay. You are the perfect candidate for this surgery and you're going to be okay. I mean, color goes out the window because, this is my life that I'm talking about here,
I specifically sought out providers who looked like me. My breast surgeon was a Black woman, and my oncologist was a Black woman. And I purposely did that because I wanted to feel comfortable and I wanted to make sure that my voice as a Black woman was being heard and my concerns were being heard.
So I'm hearing credibility, credentials, and compassion.
Yes.
Eukaria, are those the 3 C's we should be looking for?
Yes, they are. And I will add a fourth, which is concordance. Concordance is the fourth one.
Speak to me. What does that mean?
In this case, concordance can mean many things, but we're talking about that racial concordance. For many years, I've worked in healthcare, serving Black and brown patients as their oncology social worker. And working in white dominant spaces, it's interesting being one of the few team members of color serving patients who look like you. My presence mattered. Even though I'm not the doctor or I wasn't the nurse, patients frequently wanted to have conversation, just checking in with someone on the team to say, can I trust? Can I trust this team? Can I trust this process? Help me through this. And sometimes it's not even about the people who are specifically taking care of you. Mm-hmm. People are paying attention. When they walk into the doors of your healthcare system, who's doing what? Are there other physicians of color, any color? How many people are female that are walking around that are doctors or nurses? These are things that as Black people, we pay attention to. We may not talk about it, but we pay attention to that all the time. Because when it comes up later, we don't miss a beat. We say, oh yeah, I noticed that, right?
A lot of times as Black women, if we complain of pain or different things, a lot of times we're seen as very strong. And we're taught to just grin and bear it and not to talk about it. But I really wanted medical providers who could look at me and understand what it's like to be a Black woman and to make sure that those concerns are addressed.
No, I'm so glad that you shared that. Eukaria, this leads to the next question about that Superwoman complex. We feel that we have to be strong no matter what. How does that impact our mental health?
Prior to working in oncology, I actually worked in the mental health field. in an outpatient capacity, as well as inpatient acute and extended acute hospitals in Philadelphia. And so I really have seen the range of how symptoms can present themselves and what happens when symptoms are ignored, when there is a need to talk to someone and that doesn't happen, when there's a need for hospitalization and that doesn't happen, when there's a need for medication and that doesn't happen. Because when we talk about cancer, a lot of times we're talking about what it means to be physically well, but we have to talk about what it means to be mentally well, because dealing with a cancer diagnosis as a patient, a family member, the care partner, the primary care partner, it's overwhelming. It can be stressful. And so, it's like layering all of these things on top of each other. And so where there were perhaps some of those mild mental health symptoms that maybe we were dealing with when we thought we were superwomen, now you've got this other layer called cancer, and that can absolutely exacerbate some of those more minor things that maybe weren't so minor, but we were willing to just pass it off as such.
Mm-hmm.
No, well said, well said. Tamron, what was your experience? Did you feel any type of depression or anxiety because of your cancer?
I sure did. So, when I was going through my treatment, my mind was in the future, but my body was going through the treatment. So, I was not present, and I don't recommend that.
Mm-hmm.
Because for me not being present, that means that I did not sit in my feelings, dealing with that, and not knowing the symptoms and the signs of depression and anxiety. 10 years later, I was going to cardiologists, pulmonologists, neurologists, because I thought something was going on with me. I thought I was having a heart attack. Once I really found out what it was, and this is kind of like the kicker of people that have not experienced depression, have not experienced anxiety, they don't really get. They're like, so a lot of people ask me, don't you pray? What are you worried about? What are you concerned about? All you got to do is stop thinking about it. It's not that easy. I could be thinking about nothing. I could be down, driving down the road, listening to my favorite song, and boom, here comes an anxiety attack, So it took a while for my family to really realize what I was going through after knowing what it was. But my faith was still there, and I would ask God daily to deliver me from this anxiety. And not knowing that it was, I was going through a mental battle in my mind, because when you have cancer, it's not only trauma on your body, it's trauma on your mind.
Absolutely.
I'd like to talk more about the relationship between mental health survivorship. How do you prioritize your mental health?
I think that all cancer survivors should seek mental health, because if you do not take care of it, or if you do not, face things that you need to face from a mental health standpoint while you're going through your initial diagnosis, once you reach survivorship, it can show up in many, many ways. So it's very, very important to place that on your self-care list. And if you haven't today, ask your PCP to, refer you to a mental health professional.
That leads us perfectly to our next question. Crystal, how has your mental health and anxiety changed, especially because you are a cancer survivor?
Prioritizing my mental health has become very, very, very important to me. I make sure I make that time to check in with myself and make sure, again, I'm processing my emotions in a healthy way so that I can continue to be a positive advocate for the people that I serve on a day-to-day basis. Being a breast cancer survivor and being a single woman, Getting back into the world of dating and having to disclose to someone that you had cancer and you're a cancer survivor. A lot of people don't realize that cancer is just not a one and done thing. It's a lifelong thing. You're going to have mammograms and screenings, and you have scanxiety and anxiety every time you go to the doctor or have a lab work and things like that done. And then I also experienced the fear of disclosing to people that I was a cancer survivor. It's ghosting. Ghosting is real. It actually happened to me, during my journey, to dump on someone that you have cancer or to say the C word. A lot of people don't know how to handle that.
So, Eukarya, in your work, you see Black women struggling with cancer and also their mental health. What would you like to say to them?
Well, I'll repeat something I said earlier, which is they are not alone. I'm so grateful to Tamron and Crystal for sharing openly here, because what you're hearing is real. It's real, it's raw, it's present, and it is ongoing. And so that really is one of the most important messages, is that you're not alone. People may not talk about it as openly as we're talking about it here together today, but it is absolutely something that is impacting way more people than you're aware. The next thing I would say is you've got to talk about it. And who you talk about it with will vary. For some person who has a trusting relationship with their physician or nurse, that may be the person they talk to. It could be your care partner. It could be your spouse or a friend. But what is important is letting someone know that I'm not okay. I'm not feeling like myself. Even if you don't have the language to describe clinically what you're experiencing, just letting someone know that you have concerns about some of the things that you're feeling or thinking or experiencing, that is really one of those first pieces.
We talked a little bit about the Superwoman myth. What has being a cancer survivor taught you about being a superwoman?
I had to learn the hard way that it's okay to not be okay. And there's also a saying that you teach people how to treat you. And I've learned that you teach people how to help you. If you don't say what your needs are, people don't know how to help you. So I've learned that as hard as it may be, and, as independent as I am, I had to learn to ask for the help and support that I needed, just so things weren't spiraling out of control. And, asking for help is definitely not a sign of weakness. When you have cancer, there are people who want to be there for you and they want to help you, but they may not necessarily give you what you need or the things that are the most helpful for you at that time. Ask throughout the journey for the help and support that you will need.
So don't be ashamed. State what you need, and people will be receptive, and they will try to help.
Absolutely.
Let's talk about the stigma of having cancer and the barriers that, as Black women, we feel that we must address in order to access the best care, to stay positive about our condition while holding it down as a worker. Crystal, do you want to attack that?
Absolutely. I feel that there are a few barriers that Black women have when it comes to accessing the best care and to make sure that we're continuing to be taken care of through our journey in survivorship. And I think one barrier that we have is fear of retaliation for asking for help or for even asking for a second opinion or to seek out a different provider if you feel like a certain provider is not meeting your needs. For myself, and even as an advocate for my patients and in the community, I always say it's not robbery to seek help elsewhere if you're not getting what you need in one place. It's so crucial. And as Eukarya was saying earlier, you know the ins and outs of your body. You know what you feel. You know what cancer has done to you, and you know the emotions that you've had through your cancer journey. So it's so imperative that we not feel afraid to seek help elsewhere if our needs aren't getting met in that regard.
No, well said. Tamron, I'd like to ask you more about your process for accessing care and how important accessing the best care is to survivorship.
It is very important. And I have to agree what you said earlier about finding the best of the best and, doing your research. But having cancer made me more aware of, and to reevaluate who my physicians were. I do my research, and I don't just pick the first one that my insurance says, or someone down the road says, hey, go to this. No, I have to really do my research, look at the facility, look up the doctor, and meet with the physician, to be honest. And I mean, since I've been here, I have changed physicians.
I'm sorry, does that mean that you actually interviewed your physician before becoming their patient?
During that initial visit, if I feel like they can't help me, or if they're not confident within themselves, I will excuse myself and, find another physician. And I think that is very important. And I really carry that through even with my children.
That's fantastic. Eukarya, you have something to say other than amen?
Yes, let's start with amen. As you were talking, I was shaking my head like, because you're absolutely right. We truly don't ask questions. And I know I say that blanketly, and I say it that way because I've seen that happen so many times. Patients have the best questions. It could be that something was misunderstood, or let me just make sure that I'm understanding you. And this really comes from a lot of our historical experiences, raising our hand to ask questions and not being seen or heard, or having people not care that we raised our hand to ask questions or dismiss our questions. A lot of that comes from other experiences that we've had as Black people. And, I have to say, unfortunately, I've worked in healthcare a long time, and I've seen that sometimes there is a difference in how providers receive questions from us than from other patients. And so this is more than a feeling. Unconscious bias is real. It is real. And, the systems that we're seeking care in are not created equal. And yeah, there are people who have had and continue to have poor experiences in healthcare. So all of those things are true.
And I like to jump in, Eukarya, and piggyback off of what you said, because in survivorship, it's so important that, as I said, you have to ask questions, and you can't be afraid to ask questions. In my journey to survivorship, I actually was almost overlooked for a follow-up appointment that I was supposed to have. And had I not spoken up, I would have missed or not had scheduled a very important follow-up that was needed. And so learning how to self-advocate in survivorship, and, survivorship begins at the time of diagnosis. And then even once you're through the surgeries and through the treatments, you're going to continue to have lifelong needs and support in this journey. And we have to be comfortable enough to be able to ask those hard questions of our medical providers. And going back to what I said earlier about not having that fear of retaliation, you're so important. And you know how to best ask questions that will help to suit your needs. And you don't have to be a prolific speaker or, as we were saying earlier, have the correct terminology, but just get those thoughts out and just be sure to express yourself, because it's so important.
Absolutely.
All right. The last question. What has your cancer taught you, and how has your cancer influenced the person you are today? Starting with you, Tamron.
That is a very loaded question. I mean, I do believe that people go through things for a reason, and sometimes we may not know that reason. At the time, I didn't know what my reason was. But being a cancer survivor has really taught me a lot about myself. First of all, it taught me that I am stronger than I even thought I was. And I can, face tough situations. And that even though you may not have but just a glimmer of hope, but that glimmer of hope and faith can push you and get you through. Face it, but face it with faith. And just know that this is your story and you're sticking to it.
Awesome. Thank you. Crystal, same question.
I agree with Tamron. That is a very loaded question. But my journey with cancer has definitely strengthened my faith. And I've learned how to go with the flow, and that not everything is going to happen the way that you think it's going to happen. Even though you say, hey, I'm going to choose this doctor, I'm going to have this medical procedure, I'm going to have this done. Be prepared for things to go a little bit differently sometimes, not necessarily in a bad way, but sometimes things can miraculously happen in ways that you just couldn't even imagine. So even though you're going through something really, really difficult in your life, there are blessings along the way that can happen if you just learn to let go of the control, be the best person you can be in that journey. And I've also learned just to use my pain for purpose. That has been so invaluable to me in my journey. And I feel that, like as Tamron said, things happen for a reason and you don't understand why. And I now know why I had to walk that cancer journey is because it has prepared me to be a much better advocate and a help, not only professionally, but personally to people that I meet with cancer.
Wonderful, wonderful. And then Eukarya, you have the last word. What will you say to this wonderful audience in terms of their advocacy and walking each day, living with cancer or being a cancer survivor?
What I will say is this. Many of us have been on an airplane, although for some of us maybe longer than others, given the pandemic. And we all know what we hear in terms of putting that oxygen mask on ourselves first. And there's a reason that they tell you that. Our instinct, especially as Black women, is to put the oxygen mask on everybody around us and take care of everybody else's needs first. And sometimes we prioritize ourselves last. It's not because we don't care about ourselves, but it's just that we have a lot of love to give and we are caregivers to everybody. Some of us more than others, right? But I think we need to reframe that message and say that to ourselves, I want to continue to be here to support my loved ones, to support my friends, my family. But in order to do that, I've got to stop and put that oxygen mask on myself first. And so that's what I would say. Put yourself first, especially where your health is concerned, so that you can continue to be all of those things to other people in your lives.
Thank you for this incredible and inspiring conversation. And thank you, ladies, for joining us. It's not easy to open up and to share your story in such a public forum. We know that conversations like this will have real impact on other survivors. Thank you for those who tuned in today. And for those who enjoyed the discussion, you can check out more information, perspectives, and resources on survivorshiptoday.com. Again, that's survivorshiptoday.com. My name is Rosalind Young Daniels of Black Health Matters, and I thank you for joining us.